Good day, everyone. Welcome to another day of learning a new topic for our learning session. I am lovely Emlianto of Pantawid Pamilyang Pilipino Program of DSWD Mimaropa Region. Today, I will share the things that we must know about the persons with disability, the laws that protect them, and the salient points on how to interact with the persons with disability as we create an inclusive and PWD sensitive environment for them. Globally, 1 in 7 people, or approximately 15% of the world's population, have some form of disability. About 110 to 190 million people 15 years and older have significant difficulties in functioning. Moreover, the rapid spread of chronic diseases and population aging contribute to the increasing rates of disability. About 80% of the world's persons with disabilities live in low-income countries, wherein majority are poor and cannot access basic services. With their conditions, persons with disabilities need greater attention and considerations in terms of health needs without discrimination. However, reports show that persons with disabilities have less access to health services and therefore have greater unmet needs. In the Philippines, 1.57% of the household population from the 2010 Census of Population and Housing have disability. Region 4A was recorded to have the highest number of persons with disabilities among the 17 regions, while the Cordillera Administrative Region had the lowest number of persons with disabilities. For every 5 persons with disability, 1 was aged 0 to 14 years, 3 were in the working age group or 15 to 64 years old, and 1 was aged 65 years old and above. There were more males than females among persons with disability. Males with disability outnumbered females in the age groups 0 to 64 years. The largest excess in the number of males was in the age group 0 to 14 years old with a sex ratio of 121 males per 100 females. On the other hand, there were more females with disability than males in the age group 65 years and over. This is because of the higher survival rate of women than men. In this age group, there were 70 males with disability per 100 females. Disability was highest among persons aged 5 to 19 years old. In the given data, about 16 per thousand of the country's population had disability. 70% live in rural and remote areas. In the Mimaropa region, the total number of persons with disabilities in 2010 is 50,434. In the 2015 Listahanan assessment results, using the 6 domains International Classification of Functioning Disability and Health or ICF, which are difficulty in seeing, hearing, walking, remembering or concentrating, self-caring, and communicating, out of the assessed 39,738 persons with disabilities, 15,302 were poor. Now let's have a quick recap on the definition of persons with disability. According to the UN Convention on the Rights of Persons with Disabilities, persons with disabilities include those who have long-term physical, mental, intellectual, or sensory impairments which in interaction with various barriers may hinder their full and effective participation in society on an equal basis with others. Persons with disabilities are those experiencing from restriction of different abilities as a result of the mentioned impairments to perform an activity in the manner or within the range considered normal for a human being. From the International Classification of Functioning, Disability and Health, persons with disability refers to disability as an umbrella term covering impairments, activity limitations, and participation restrictions. An impairment is a problem in body function or structure. An activity limitation is a difficulty encountered by an individual in executing a task or action, while a participation restriction is a problem experienced by an individual in involvement in life situations. The International Classification of Functioning's definition of disability denotes a negative interaction between a person with a health condition and his or her contextual factors or environmental and personal factors. A comprehensive approach in interventions is then necessary for persons with disabilities, as it entails actions beyond the context of health, but more on helping them to overcome difficulties by removing environmental and social barriers. Persons with disabilities are not defined by their impairments. We should always put people first, like the phrase persons with disability rather than disabled person. Avoid phrases such as suffers from and afflicted by, as they carry negative connotations. You could simply say that a person has a certain disability. Here are a few tips on the writing guidelines and disability terminology. When writing or referring to persons with disabilities, it's important to be concise. However, sometimes the effort to limit wordiness leads to inappropriate references to people with disabilities. Do not sensationalize a disability by saying afflicted with, crippled with, suffers from, or victim of. Instead, write person who has multiple sclerosis or man who had polio. Do not use generic labels for disability groups such as the retarded or the deaf. Emphasize people, not labels. Say people with mental retardation or people who are deaf. Put people first, not their disability. Say woman with cancer, children who are deaf, or people with disabilities. This puts the focus on the individual, not the particular function limitation. Emphasize disability, not limitations. It is correct to say uses a wheelchair, uses braces, or walks with crutches. While it is not okay to say confined to a wheelchair, wheelchair bound, or crippled. Similarly, do not use emotional descriptors such as unfortunate, pitiful, and similar phrases because they reinforce the idea that disabilities cannot be dealt with directly and candidly. Do not imply disease when discussing disabilities that result from prior disease episode. People with disabilities should never be referred to as patients or cases unless the relationship with their doctor is under discussion. Let us see the persons with disabilities as active participants of the society. Portraying persons with disabilities interacting with people without disabilities in social and work environments helps break down barriers and open lines of communication. They are also considered as a vulnerable sector in the society that we in the department advocate for inclusivity and integration towards social change. We may come across many persons with disabilities in our life. They may be members of the family, relative, classmates way back in school, friends, or colleagues. There are times that the kind of disability is not clear to us, how it affects their work, and if they need adjustments so they can work to the best of their ability. There are disabilities that has developed during the person's lifetime or the so-called acquired disability, which is a result of an accident or illness. There is no definitive list of this disability, and they can be visible or invisible. Here are the examples of accident-related and illness and health-related disabilities. For accident-related disabilities, they are head trauma, spinal injuries, loss of vision, loss of hearing, and injured or loss of limbs. While illness and health-related are post-stroke, post-traumatic stress, multiple sclerosis, arthritis, motor neuron disease, mental illness, and stress. On the other hand, Developmental disabilities are a group of conditions due to an impairment in physical, learning, language, or behavioral areas. These conditions begin during the developmental period, may impact day-to-day functioning, and usually last throughout a person's lifetime. Here are the examples of developmental disability. Attention Deficit Hyperactivity Disorder or ADHD, Autism Spectrum Disorder, Cerebral Palsy, Hearing Loss, Intellectual Disability, Language and Speech Disorders, Learning Disorders, Muscular Dystrophy, Tourette Syndrome, and Vision Impairment. The major types of disabilities include physical, mental, intellectual, and sensory. Physical disabilities are those apparent or visible like those orthopedic, persons who use crutches, cane, or prosthesis, those who are amputated, or with physical deformity on upper and lower extremities. But disabilities also evolve. There are also internal deformities which are not apparent but affects the mobility of the person like those persons with scoliosis. The new law protecting the persons with disabilities or Republic Act 11215 recognizes those people living with cancer. They are categorized as persons with disability and shall be accorded with the same rights and privileges as persons with disability. Mental illness. Mental illness is a general term that refers to a group of illnesses that significantly affects how a person feels, thinks, behaves, and interacts with other people. Mental illnesses can be very difficult and debilitating to those experiencing them, as well as their families and friends. They can also be permanent, temporary, or can be a come-and-go kind of illness. Some of the main groups in mental disorders are mood disorders such as depression or bipolar disorder, anxiety disorders, personality disorders, psychotic disorders such as schizophrenia, eating disorders, trauma-related disorders such as post-traumatic stress disorder, and substance abuse disorders. Intellectual disability is characterized by someone having an IQ below 70, as well as significant difficulty with daily living such as self-care, safety, communication, and socialization. People with an intellectual disability may process information more slowly, find communication and daily living skills hard, and also have difficulty with abstract concepts such as money and time. An intellectual disability may be caused by a genetic condition, problems during pregnancy and birth, health problems or illness, and environmental factors. Sometimes, an intellectual disability is caused by an environmental factor or other causes. These causes can be quite varied but can include problems during pregnancy such as viral or bacterial infections, complications during birth, exposure to toxins such as lead or mercury, complications from illnesses such as meningitis, measles, or whooping cough, malnutrition, exposure to alcohol and other drugs, trauma, and even unknown causes. Lastly, the sensory disabilities are disabilities of the sense of sight, hearing, smell, touch, and taste. As 95% of the information about the world around us comes from our sight and hearing, a sensory disability can affect how a person gathers information from the world around them. Examples are those with autism spectrum disorder, blindness and low vision, hearing loss and deafness, and sensory processing disorder. Autism spectrum disorders are a lifelong developmental disability. They affect the way someone interacts with the world around them, as well as with other people. A person is considered legally blind if they cannot see at 6 meters what someone with normal vision can see at 60 meters, or if their field of vision is less than 20 degrees in diameter. A person is said to have low vision when they have permanent vision loss which affects their day-to-day life and cannot be corrected with glasses. Blindness and low vision can occur as a result of a number of different diseases, conditions, or accidents. Some eye conditions are congenital, while others are caused later in life. Some specific causes of vision loss can include an injury to the eye defects, albinism, macular degeneration, diabetes, glaucoma, cataracts, and tumors. While some forms of vision loss can be prevented and even reversed, others may develop as people age. It is more common in those over the age of 65. Hearing loss is also known as a hearing impairment. It is the partial or total inability to hear. If someone has very little or no hearing, the term deaf may be used. Damage to any part of the external, middle, or inner ear can cause hearing loss, which can range from being mild to profound. Causes of hearing loss can be quite varied and can include problems with the bones within the ear, damage to the cochlear nerve, exposure to noise, genetic disorders, age, trauma, and other diseases. Sensory processing disorder is a condition where a person has trouble receiving and responding to information that comes in through the senses. This may mean they misinterpret everyday sensory information such as touch, sound, and movement. When someone has sensory processing disorder, they are able to sense the information. However, the brain perceives and analyzes the information in an unusual way. It may affect one sense only, or it may affect multiple senses. Some people with sensory processing disorder are oversensitive to things in their environment. Common sounds may be painful or overwhelming, and the feel of certain textures on the skin may be very uncomfortable. It is debated whether sensory processing disorder can be a disorder on its own. However, it is accepted as a common characteristic of other disabilities including autism spectrum disorders, dyslexia, and Tourette syndrome. Again, the types of disabilities are physical, mental, intellectual, and sensory. And under each category are many subcategories of disabilities, and for some persons with disabilities, they may have two or more types of disabilities, which is called multiple disabilities. The persons with disabilities also face different challenges in life. One of the most prominent challenges that they experience is discrimination. They experience discrimination in employment, transportation, and in public accommodation and services. Discrimination are usually rooted from wrong attitude or perception, misunderstanding, or lack of awareness. People with disabilities, including children, encounter a range of attitudinal, physical, and systemic barriers when they attempt to access health care, such as physical barriers related to the architectural design of health facilities or health providers' lack of adequate knowledge and skills in providing services for persons with disabilities. There are four identified barriers that should be removed. The first is physical barriers. Examples are narrow pathways and poor lighting. Next is attitudinal barriers, the ignorance, fear, and pity over the persons with disabilities. Third is information and communication barriers. That's why there are sign language interpreters to address this barrier. And last is the systematic barriers, which include policies on hiring process or courses which are not PWD friendly. Therefore, actions or interventions should be undertaken to ensure that persons with disabilities have access on an equal basis with others to health facilities and services. It is important to identify all of these barriers and institute collective actions to remove these barriers and improve access of persons with disabilities to health services and programs. To address the needs of persons with disabilities, there are laws that protect them in the country. These privileges can be availed by presenting a special PWD identification card under the Republic Act 10754 or an act expanding the benefits and privileges of persons with disability. Amending Republic Act 7277 or the Magna Carta for persons with disabilities. The ID card is valid for 3 years and free of charge when issued for the first time. Having this PWD ID, persons with disabilities are entitled with benefits and privileges like 20% discount and value-added tax exemption. It can be availed when buying certain products and services nationwide, which include room accommodations in lodging establishments, including dormitories for students, restaurants, cinemas, theaters, and other recreational centers, medicines, and food for special medical purposes, medical and dental services, including professional fees, diagnostic, and laboratory fees, fares for domestic air and sea travel, fares for land transportation including jeeps, buses, taxis, trains, and TNVS or ride-hailing services, funeral and burial services for the death of a person with disability. However, persons with disabilities can get double discounts. If a particular service is on a promotional discount, persons with disabilities can avail of either the 20% PWD discount or the establishment's offer discount, whichever is higher. Another privilege is the 5% discount on basic necessities and prime commodities. The special discount applies to purchase of products such as rice, meat, fresh fruits, drinking water, sugar, construction materials, and other commodities as determined by the Department of Agriculture and Department of Trade and Industry. To qualify for the 5% discount, the total purchase should not be more than 1,300 pesos per week. Any unused amount cannot be carried over to the next week. They would also have mandatory coverage under SSS or GSIS, PhilHealth, and Pag-ibig, wherein membership with the Social Security System or Government Service Insurance System, PhilHealth, and Pag-ibig Fund is compulsory for PWD workers in the Philippines. This means that all working persons with disabilities are entitled to the same benefits from these government agencies as other members. The law also requires establishments to create express lanes for persons with disabilities. They are a priority in all commercial and government transactions in the Philippines. The next law is the Batas Pambansa number 344 or the Act to Enhance the Mobility of Persons with Disabilities, which simply states that establishments shall have architectural facilities assisting the persons with disabilities such as sidewalks, ramps, and railings. The scope includes the public and private buildings and related structures for public use and which shall be constructed, repaired, or renovated, streets and highways and public utilities, public transport vehicles, public telephones, and public transport terminals. For the employees with disabilities, the Republic Act 10524 is the act expanding the positions reserved for persons with disability. In Section 5, no person with disability shall be denied access to opportunities for suitable employment. A qualified employee with disability shall be subject to the same rights, terms, and conditions of employment and the same compensation, privileges, benefits, fringe benefits, incentives, or allowances as a qualified able-bodied person. Here's a quick peek on the other laws that protect the persons with disabilities, which you can access in the internet and other online platforms. Republic Act 10070, or the Act establishing institutional mechanism to ensure the implementation of programs and services for persons with disabilities in every province, city, and municipality, or the creation of Persons with Disability Affairs Office, or PDAO. The Republic Act 10366, or the Act providing accessible polling places exclusively for persons with disabilities and senior citizens. Executive Order 417, or the implementation of the Economic Independence Program for Persons with Disabilities. Republic Act 10747, or the Comprehensive Policy in Addressing the Needs of Persons with Rare Disease. Republic Act 11228, or an act providing mandatory PhilHealth coverage for all persons with disabilities. The direct service provider for persons with disabilities is the local government units or LGUs, specifically the city or municipal social welfare and development offices. They identify the target beneficiaries, generate and mobilize resources for the provision of social services. They also develop and maintain linkages with non-government organizations, people's organizations, and other government agencies. Meanwhile, the field offices provide technical assistance to LGUs and other intermediaries in the operationalization of programs and services to persons with disabilities. As staff of the Department of Social Welfare and Development, the lead organization in promoting and advocating for the rights of the marginalized sectors, including the persons with disabilities, the purpose of awareness is to create a better understanding of disability as a whole. We may encounter and interact with the persons with disabilities in our line of work, in the office, or in the field. And it is a must to know the salient points on understanding the persons with disability and how to interact with them. What do you do when you meet someone with disability? Here are some tips on how we should interact with persons with disabilities based from the types of disabilities that I have mentioned earlier. For persons with physical disability, the common characteristic is that some aspect of a person's physical functioning, usually either their mobility, dexterity, or stamina, is affected. People with physical disability are usually experts in their own needs and will understand the impact of their disability. While interacting with them, always ask before offering assistance. Be at the same level when talking with a person. Never assume that a person with physical disability also has intellectual disability. Ask permission before touching a person's wheelchair or mobility aid. Address him or her directly rather than through a companion. For persons with mental illness, their illness affects the way a person thinks, feels, and acts. A person with a mental health condition may experience difficulty concentrating, which can sometimes be a result of medication. Try to avoid overly stressful situations wherever possible so that their condition is not exacerbated. Provide clear and thorough explanations and instructions in writing if required. Ask the person how they would like to receive information. Ask before you help. Speak normally. Be mindful of the environment. A smile is great. Ask when you're unsure, and you should also relax. For persons with intellectual disability, they may have significant limitations in the skills needed to live and work in the community, including difficulties with communication, self-care, social skills, safety, and self-direction. The most important thing to remember is to treat a person with intellectual disability just like everyone else. Treat them as you would like to be treated. Be considerate of the extra time it might take for a person with an intellectual disability to do or say something. Be patient and give your undivided attention, especially with someone who speaks slowly or with great effort. Keep the pressure of any given situation to a minimum, as stress can affect a person's concentration and performance. Keep instructions simple and in bite-sized pieces. Be aware that a person with intellectual disability may be less aware of the social cues and may have less developed social skills. give verbal and written instruction, or try giving examples to illustrate ideas and summarize ideas often. For persons with sensory disabilities, you can consider these tips. When talking with a person who is blind or has a vision impairment, always identify yourself and any others with you, as if a person requires assistance, and listen for specific instructions. However, be prepared for your offer to be refused. Ask if they need assistance, and if they allow you to help them, ask if they would like to take your elbow or shoulder. Describe any changes in the environment, such as steps or obstacles along the way. Walk half a pace ahead of the persons you are guiding. Identify yourself when approaching someone with vision impairment and inform him when you are leaving. Make sure to constantly look out for them and to keep your pace steady. Inform persons with disabilities of the potential barrier ahead of the events that involve them. Consider their needs ahead of time. If the person has a guide dog, please remember that the dog is working and should not be patted, fed, or distracted. For people who are deaf or hard of hearing, take note that hearing impairments can range from mild to profound. They may use a range of strategies and equipment, including speech, lip reading, writing notes, hearing aids, or sign language interpreters. When talking to a person who is deaf or hard of hearing, look and speak directly to them, not just to the people accompanying them, including interpreters. Speak clearly and use a normal tone of voice unless otherwise instructed by the person with a hearing impairment. If you don't understand what a person is saying, ask them to repeat or rephrase, or alternatively offer them a pen and paper. Ask before offering help. Some appreciate while others are able to move around on their own and do not require help. Do not be offended or embarrassed if your help was declined. Speak directly to him or her. Speak directly to the person, not to his companion, sign language interpreter, or caregiver. Be sensitive about physical contact. Wheelchairs, white canes, and guide dogs are considered personal space. Do not touch this without first asking the person for permission. Don't make assumptions. Persons with disabilities know themselves best. Allow them to make their own decision about participating in any activity. There are many more tips on how to interact to persons with disabilities according to the particular disability they have. The bottom line here is for us to build more respect for them and create a more inclusive and PWD sensitive environment for these persons with disability. Remember that disability is not black and white. Two people with the same type of disability may not have the same experiences. Let us see the person, the individual, instead of seeing them as their disability. They are not defined by their impairment. If you are afraid of them or uncomfortable around them because of their disability, you may do some research to learn more. As what Robert Hensel said, there is no greater disability in society than the inability to see a person more. Thank you so much for listening. You can share your thoughts on what you have learned on our topic. You can like the video and don't forget to subscribe to this channel. Have a nice day ahead